Today, I want to talk about incontinence. I have found that this topic, in all of my time of teaching or working with patients and clients, is the one in which people have the most questions and the most concerns. It is one of the biggest problems that is faced in the United States alone. The statistics show 1 in 3 women suffer from some level of urinary incontinence. The truth behind that is that statistics are probably more realistically closer to 1 in 2 women, because they say women lie on forms. Who knew? So the reality, close to 50% of all women suffer from some level of urinary incontinence. So what is incontinence? Incontinence is defined as any involuntary loss of urine. The key being any involuntary loss of urine. The big thing to remember here is that with urinary incontinence, it does not have to be full loss of urine, meaning you've completely wet your pants or the bladder has completely emptied on you unwantedly. Literally having 2 drops of urine come out when you laugh, sneeze, try to get to the bathroom, try to stand up from the toilet, or any other time unwanted is considered incontinence. In the medical community, incontinence is labeled into 3 main types. The first type is called urge incontinence, which is considered an involuntary loss of urine that occurs with a strong desire to urinate with very little warning. This is that really strong sense of urgency and feeling like you can't get to the bathroom on time. The second type you might hear about is called stress incontinence, which is an involuntary loss of urine with physical exertion. This is peeing your pants with coughing, laughing, sneezing, and jumping on the trampoline with your kids. The third type is called mixed, which, as you would expect, a combination of both urge and stress incontinence. So what are options for treating urinary incontinence besides the obvious exercise and MyCore floor? Physical therapy is another conservative approach, but different than a generalized core program. It can be more personalized and directed specifically to your condition and other factors you may be dealing with that could be directly impacting your incontinence. In addition to exercise, your physical therapist may do some direct pelvic floor work or soft tissue and manual work to the surrounding areas, including the pelvis, hips, or spine. Other incontinence treatment options include medications, for which there are a wide variety out there, surgical intervention where a bladder sling or urethral sling are performed, which are only a couple of the many options available. One of the last options for incontinence management is the use of diapers or pads. This is the last resort option in my opinion, yet one that millions of women are turning to in order to handle this problem. This is a problem that is not okay. It is a problem that is treatable and in many cases preventable. Letting it just be as it is and accepting it by wearing a diaper or pad is not acceptable in my book.